Hi, welcome to our webinar about studying medicine in English at Andrzej Frycz-Modrzewski Krakow University. I'm Emilia and I'll be your host today, and I'm pleased to be joined by Professor Janusz Ligęza, who is the Dean of Faculty of Medicine at our university and an experienced medical educator. Professor Ligęza has a PhD in biological sciences with a specialization in biochemistry and also a strong academic background in cancer biology, cellular signaling, and data analysis, which enriches both his teaching and leadership of medical faculty. Welcome, Professor. Thank you for being here today with us.
Thank you, Emilia, for inviting me to this webinar. Hello to everyone. It is a great pleasure to meet you all and to discuss about our program today, how it is built and how it is introduced. As Emilia mentioned, I have a background in life sciences. I've graduated biotechnology at the Jagiellonian University. I've done my PhD studies at the same university, and at 2016 I joined the Andrzej Frycz-Modrzewski Krakow University because of the newly created medical program in this university. And from the beginning, I was introduced into the teaching and, of course, the research. Later on, I was involved in some kind of administrative work, and subsequently, I've become more responsible for the whole program. I started as a vice dean of the faculty, and right now I'm the dean of the Faculty of Medicine.
I'm really happy that we can meet because in today's webinar, we're going to put ourselves in the candidate shoes and talk about medical program, answer some of the most common questions of the candidates. So if you're currently thinking about your future and thinking about medical program, this place is for you. So thank you for being here, and without further ado, let's move to my first question, which is, I think everybody knows that medical program and medical specialization is really demanding but also rewarding path. And I'm wondering, from your perspective, what usually motivates candidates to choose medical program overall and in Krakow?
I think that the most common reason to start the studies in medicine is the need of those people to help others. So to help people, cure them, they are very motivated in doing something meaningful. And I think that the treating the patient, saving someone's life.
Yeah, and I think about the Krakow, Krakow is a really excellent city for medical students because of its safety, accommodation, public transport, closeness of everything, also the history. And I think the public transport is easy to use. We have main train station really close, of course, airport, that you can go there by car, bus, train, whatever. Accommodation is really not expensive in comparison to other European countries, which is good, and student has a lot of options for location and price, and they can choose from hostels, hotels, students' residences, shared flats, of course. And I think the closest students' residences are just 100 meters from the university, which is on
Just
the other
across the street.
yeah, just across the street. So that's just pretty close, and that's really a big advantage for them, so they can focus on the studies. And about the university, it is located next to the Vistula River, not far from Kazimierz, Zabłocie, and like 30 minutes by foot to Main Square and Wawel Castle, right?
Yes.
Yeah, and the university has 25 years of history and is the largest non-public university in the southern Poland, and also, like you mentioned, the first non-public university to teach medicine. And that leads me to my first question about the medical program, which is, how did it happen that Fritz University can teach a medical program, and why do you think this medical program is a good option for candidates?
So we have a strong academic background in Krakow. There's a lot of other universities, technical universities, agricultural universities. So this city is kind of one of the biggest, and I think one of the strongest academic cities in whole Poland. And getting back to your question about how it was possible to start medical program in our university. So it was a great effort of dozens of people who applied to the Ministry of Education and Ministry of Healthcare for approval to start the medical program in our university. It was possible to start with in 2016. In 2015, we got the decision of Minister of Healthcare, and as I said, it was very difficult at that time getting this approval from the ministry.
Yeah, right. And it's really amazing that it's like 2016, so that's a huge time of teaching medical students. And also, like you mentioned, is like the importance of practical training. And I think that is what usually motivates candidates to go to medical studies here, because they are asking mostly when they would begin to gain practical medical experience, and how is the balance between the theoretical and practical knowledge maintained, and also about the hospitals and clinical partners that are going to study in. So my question is, if you can tell us a little bit about the overview of the structure of this medical program.
Okay, maybe let's start with a history, because we were the first non-public university which established the medical program. We had a chance. My colleagues had a chance to create it in other way from other universities. It was not classical program as in most of the Polish medical universities. It was based on some programs from United States or Canada. So it's modular. So we're teaching in slightly different way. And this modality of the program, you can see in every step of the curriculum, our curriculum. And maybe we can start with the basic sciences. We are starting in the first year, teaching not in a classical way separately anatomy, physiology, histology, and radiology. We are teaching in so-called modular subjects, like, for example, a musculoskeletal system or cardiovascular system or pulmonary system. So we are focusing on the system. We are teaching the structure, microscopic structure during the histology classes, anatomy during the section classes, because we have section room.
So it's just a general overview, right?
Yes, general overview. And then they are trying to understand how those body parts are working, how the whole functioning of those organ systems is regulated. So they are learning physiology as well during the whole module. And they are also are exposed to some preclinical sciences, because we are teaching them how to recognize some structures on the diagnostic images created in real hospitals. So they have a quite good view on how the body works and how it's built.
I feel like it's a really important aspect, because even if they have a specialization, it's nice that they have the overview of everything and they can connect.
And it's much easier to learn. And one more thing I need to add. Those modules are one after another conducted. So they are, for example, completing one part, they are passing the exam, and they are moving to another section. So the workload for those students is slightly less during the exam session in the first years than in other universities. So I think that this is something
so they can focus
not
just
common.
on one module and then...
Exactly.
Okay.
And so this is the way that we are teaching those basic sciences. During the first year, the students have during the first year, they have first encounter with the patient. So it's kind of a innovation. It's because the students are having classes in, for example, in a psychiatric hospital. So they are exposed to the somehow patient with some problems with communication, and they are trying to get in touch with those.
They have
those
just
people.
Practical skills just from the beginning.
So we are starting with the communication. First of all, we are focused on teaching them how to listen to the people. And then during the second year, they are starting learning some practical professional skills, like for example they learn how to perform a medical interview, and this, because of the national regulation, it has to be conducted in a specific way, so we are teaching the Calgary Cambridge way of taking the interview. In the next semester they are having physical examination, and at this point they are starting also the classes in medical simulation center. We have our own great
I saw it,
equipment
it's amazing.
in simulation center. I forgot, before they complete the first year, so during the second semester, they are starting to also learn some practical medical skills. For example, they are doing the introduction to nursing practice. Because after each year, starting from the first to the fifth year, the students must have some summer clerkships, 1 month, in different areas of medicine. So they are starting with nursing, then after the second year they have outpatient care, then internal medicine, surgery, pediatrics, etc. After another completed years. After completing the second year, they are entering the real clinical classes. We are starting in the fifth semester with also modular subject. It's called Introduction to Clinical Medicine. It combines propedeutics of surgery, pediatrics, and internal medicine. And students have some classes in simulation center. They are having the classes in real hospital environment. We have a great network of clinical hospitals cooperating with us.
I think that's amazing that you mentioned, like, we have this medical center, we have this section hall, modern laboratories, and also the hospitals, which are not far away, so they can focus on studies and practical aspect.
Yes, of course. And we had a chance, of course, while starting the cooperation with different hospitals located in Krakow, and few of units are located outside of Krakow. I will mention it later, maybe. So we had a chance to choose with whom we are cooperating during those clinical classes. So we have great experts in medical sciences, teaching our students the practical medicine in real hospitals in Krakow.
And that's what I have in mind. Like you mentioned, people teaching. Like, I would like to ask about lectures. Like, what kind of experience do they bring? Who are they?
So most of the staff are graduates of the biggest and renowned universities in Poland. I've mentioned Jagiellonian University. We have also graduates from other very good universities in Poland, like Silesian Medical University or few others. So this was the great chance for us, because as I've mentioned in the beginning, Krakow is kind of an academic center of southern Poland or Małopolska voivodeship.
Yeah, and everybody is coming from southern Poland just to us. So let's go to the students themselves. I was wondering how international is the program, who is it designed for, and also if there's some students organizations, research opportunities, or extracurricular activities for students available.
Okay, so a lot of questions.
A lot of questions in one, yeah.
So let me start with something simple. So the program is for people who want to help other people, and as I said before, there's a chance to also take another path, for example, research path, because we have a lot of science clubs in our university. They have their own.
Can they attend from the very first year?
Yes, they can start, but it's rather those clubs are rather focused starting from the first year. The students should start with something simple, for example, anatomy, genetics, and some basic sciences. Then, when they learn more about the physiology, pathophysiology of the human body, they can start other classes. And during the clinical classes, they are meeting the real doctors, which are becoming their kind of mentors. and they can take care of the group of the students interested,
That's
for
good.
example, in cardiology, pulmonology, and any other
There are
medical
small
sciences
groups
areas.
focused on.
Mainly on some diseases, some systems, or some specializations in medicine.
Okay, and about the students, because when somebody is attending Polish medicine, it's mostly from Poland, right? But international English medicine, who are the students? Where are they from? Do you know mostly?
At some point, I've done some statistics. Most of them were from Europe. Like we had students from Italy, from Germany, Austria, Great Britain. Right now, we have some students from France. We have a few students from USA, one from Canada. We had a lot of Norwegian students, so it's kind of a multicultural
from everywhere,
group from
actually.
everywhere. Actually, almost.
That's good. Like, I have a place to spend time with each other and communicate and just practice in English. And also, I would like to ask, because mostly during studies, students try to work part time, but it's medicine. So the question is if it's possible to work part time, and also if not, if there are some scholarships for students.
Okay, so I have one example in mind from Polish division, because I've met one of the students who told me about his experience studying in our university. So because of some gaps between the classes, he's driving a taxi. And the taxi
Okay.
driving is very nice for also using the time for learning, because he's taking the books to the taxi,
Yeah.
and while he's waiting for
Audiobook and-
yes for someone to transport in his taxi, he can read something, or he can listen to webinars, to watch some medical
Yeah, books.
materials.
Yeah, and I think it's like we mentioned before, the city is not that big, so they can travel, they can work really closely. They didn't have to travel like an hour to reach the destination. So I think even anything near the university, they can just work part time. And about the working after university, I feel like, what does the program prepare students in terms of professional career qualifications, exams, licensing, and the career opportunities, of course in Poland, but also abroad?
So in case of Poland, to get the license to practice medicine in Poland, you need to fulfill three conditions. First of all, you need to have a diploma of medical studies from a recognized university. We have a accreditation of Polish Accreditation Committee, which guarantees that our program is conducted and created in a way which is fully covered by standard of clinical and practical teaching, national standards. And so this is the first condition. The second condition is taking and passing the leg examination. So this is the final medical examination. You need to pass it. There's a lot of platforms helping to prepare for this type of examination. We also do during the classes, especially during the sixth year, we are helping students to prepare themselves for this licensing examination. And the final step is taking so-called stage. So they need to attend at least 1 year of postgraduate training in the hospitals.
Okay.
They are working during this period, so it's outside of the university. It's organized by local
it's paid.
authorities.
It's paid, like
Yes, it's paid.
Oh, okay, that's amazing.
And as I've heard, in some cases it's better paid than, for example, for the doctors who have finished this stage.
Okay.
So it's maybe interesting.
That's interesting.
And last and final condition to practice in Poland is to learn the Polish.
Okay.
Because it's unfortunately, to practice the medicine in Polish, it's required to communicate with the patient in Polish.
Yeah, right, because most of them just speak Polish. Right?
There are also the chances, for example, to take some exams abroad, because our students are applying, for example, for UMSLE examination. This examination is performed in United States, and it's required, for example, to enter the medical license, to get the medical license in USA. So we are also helping the students to get admission to this examination, and they have the chance to work even abroad, even in United States, in America.
That's amazing. That they can just choose whatever they wish for.
Polish Accreditation Committee has it's recognized by WFME, World Federation for Medical Education. Therefore, all the programs accredited by PKA are recognized by member states of this organization. So each country which is the member of WFME or have a connection with WFME recognizes automatically our program.
That's amazing. So moving on to the first step, actually, so we just went for backwards. If the candidate wants to apply to the medical program in English, they actually have to cover some aspects. And it's important to talk about the admission process because it's a little bit different for a medical program and for just a classical program, which is, first of all, candidates need to have a matura exam or equivalent in extended level with a minimum score of 30% from mathematics, physics, biology, chemistry, right? Or chemistry. Also, they need to have an English proficiency at B2 level or higher.
Exactly.
And if they are not European Union citizens, they need to have language verification, recommendation from NAVA, and entrance exam.
Yes.
And they have admission specialists to help them during the way, because I can imagine that starting medicine or studies abroad, not your country, is really stressful. So that's why we have amazing admission specialists. And if you're thinking about applying on a medical program, the steps are simple. At first, you go on our website, then there is admission page, and you find medical program. There is a button, apply online, the yellow button, and then it's the first and final step that I'm going to talk about today, which is a short form, where students just fill out the simple information about themselves and the contact details, and then the admission specialists appear and help them from the very beginning to the last moment of admission. So I think that's really good. But about the process, do you think that there is something more that candidates need to remember about the admission process?
I think that you've pinpointed all the details of the admission process, so it's completely correct. There may be some requirements, but just after being admitted, the students must provide some medical certificates because, as we've discussed this earlier, they are starting the contact with the patient during the first year, so there are some rules for entry of the students to the hospitals.
Mm-hmm. Okay, that's good. So just contact with admission specialists and they will help you. So another question that came to my mind was transfers from another universities. Is it possible? And if yes, how does the modular system affect this?
So this is kind of a difficult process. It's not easy even for transferring of Polish students between different universities because of the differences in the curricula.
Yeah.
Each university, all universities must fulfill all the requirements from standards of teaching in medical studies, in medical programs. So there's a specified number of hours, a specified group of subjects with the specified number of ECTS points, specific way of teaching the clinical part. There's a requirement to have a simulation center and a few other details I don't want to bore you to death with. So each program must have specific structure, but there are some differences in a way. We are creating this program. As I've mentioned in the beginning, we have different approach to teaching the both clinical and preclinical subjects. this modular. In case of other universities, they are teaching the classical way. And even if they are teaching the classical way, they can, for example, start teaching the internal medicine about pulmonology in the for example, the fourth year, and they are moving on to the cardiology to the sixth,
Right.
during the fifth year. And the other university may do it in opposite way, different way. So therefore, the transfer is difficult, but it's possible, and we are transferring the students to our university. There's a lot of work because we need to compare learning outcome, because the learning outcomes are the most important thing students must get. The number of hours and the number of ECTS points is something second in terms of importance in this way.
Okay.
In this matter.
Thank you. So I think we have the final question, and I would love to ask you about your advice to candidates that think about the future and consider medicine program, consider maybe Krakow, maybe Poland, maybe Fridge. What can you tell them just at the start of the journey?
So first of all, we've talked about some requirements for admission. We are requiring from the students to have some basic knowledge of basic sciences. So even if you do not, for example, attend such classes in your secondary school, I strongly encourage to learn some basics of chemistry, biology, because it will be much easier during the first years of studies to enter higher education and to have a great success after the first year during, for example, the examination session.
Yeah. And from my side, I must tell that it's really important to maybe think a little bit earlier about contacting. It's the advantage for a candidate because you can contact us, call us, write an email, ask your question. All these amazing admission specialists are going to answer you, so you don't have to wait till the last time to just ask the question. Yeah, and thank you. I think that's all for today. Thank you so much for this insightful conversation.
It was nice meeting you and having a time to talk about our program to prospective candidates for our medical program.
Yeah, thank you so much, and see you at Fridge.
See you at Fridge.